This video is for educational purposes only. It is not a substitute for medical advice. If you have any symptoms or concerns, you should always consult your healthcare provider first. Hey guys, in this video I am covering the topic of endometriosis. Now this condition is quite complex and it's arguably one of the most misunderstood conditions out there. It affects at least 1 in 10 women, and I would say that the actual number is much higher than that because to get an actual diagnosis it can take around 8 years. What modern medicine currently knows about this condition is, well, not much at all. As it is currently understood, it is believed to be caused by the endometrial lining of the uterus to start growing outside of the uterus into places like the fallopian tubes, on the ovaries, and anywhere within the abdominal cavity or the pelvic region, causing lesions of endometriotic tissue and eventually also scar tissue, creating a lot of pain specifically during a period. This pain is believed to be caused by the endometriotic tissue or lesions then also shedding with the normal lining of the uterus, but this has never actually been observed. The shed tissue then appears to seep onto neighboring tissue, causing inflammation and irritation that then results in cystic-like growths on the neighboring tissue. Many women, however, experience pain in between periods, and the interesting thing here is that many women with severe pain can sometimes have mild forms of this condition, whereas women with severe forms of this condition sometimes only have mild pain and sometimes no pain at all. This is often used by doctors as a reason to make them feel like the pain is either all just in their head or that they have a very low pain tolerance. The theories as to why the endometrial lining starts growing elsewhere are all based on something malfunctioning within the woman's body and are all very weak when actually put to the test. The most popular and persistent theory is that of retrograde menstruation. This theory hypothesizes that a woman's period will flow back through the fallopian tubes and into the rest of the reproductive system, leaving behind small cells that originated from the endometrial lining, causing them then to replicate in the new site. But despite this theory's popularity and persistence, it has already been proven many times to be false. The man, a Dr. Sampson, who proposed this theory, originally believed that the endometriosis was caused by what he called ovarian seedlings. So he originally thought that the tissue was coming from the ovaries, but because he didn't understand or could not observe why the ovaries would suddenly implant elsewhere, he had to abandon that theory and came up with his most recent one, which is the retrograde menstruation. The reason why I mention this is because there is a lot of truth to his original theory, and I will get to that in a moment. Research now shows unequivocally that the endometriotic tissue is not originating from the endometrial lining at all. This tissue appears to be very similar, but it is definitely not identical and is now being referred to as endometrial-like tissue. And this is really important, so keep that in mind. The tissue also does not shed like the normal endometrial lining and appears to react to estrogen in a very different way as it contains different estrogen receptors within it. Now that we have covered all of that, let's take a completely different perspective. If you have not watched my previous video on ovarian cysts, I would suggest you go back and watch that one too, as it will give you a more complete picture of what I'm about to talk about. In summary, ovarian cysts are caused by a conflict of loss. This can be a breakup or a sudden disappearance or death of a loved one, and sometimes it can also be caused by a betrayal or nasty conflict involving a male. During the conflict activity, one of the ovaries will take the impact of the shock and it will undergo tissue breakdown. Once the conflict has been resolved, this tissue will then go into the healing phase. Here, a fluid-filled cyst will replenish the cells that were lost during the conflict activity. This cyst will grow new ovarian tissue within it. It will eventually lose most of its fluid, shrink, harden, and merge with the ovary. This will create a small cell increase within that ovary, and the purpose of this is so that the ovary can now produce even more estrogen than before, making the female more attractive and ready to mate to the opposite sex, essentially to replace that loss. Now, with endometriosis, the cyst will not fully complete the healing phase because it will accumulate too much fluid within it, causing it to rupture or burst. This will release the content of the cyst into the reproductive system and anywhere in the abdominal region. These cystic cells will stick to whatever surface that they come into contact with, and there they will grow new cysts on a smaller scale attempting to complete their job, but now in the wrong place. This causes areas of blisters, inflammation, swelling, and pain. If you have ever had a blister somewhere on your foot, you will know how much pain this causes, and you can just imagine how painful it would be to have hundreds of these blisters on your insides. To add insult to injury, these new lesions of blisters can also rupture, releasing their contents further into the area. New ovarian cysts may also develop on the ovaries if the loss conflict was not fully resolved before, or if the person undergoes another loss conflict. Say for example, if she is told that she may not be able to have a baby because of this condition. This then causes the cycle to repeat indefinitely even after the removal of these lesions by surgery. So as you can see, this tissue, despite its name, is not related to the endometrial lining at all, and instead it originates from the specific estrogen-producing cells of the ovaries. This also explains why even after a hysterectomy, women can continue to experience endometriosis, even though the endometrial lining has been removed. If you have this condition and you were first diagnosed with this and then subsequently were diagnosed with an ovarian cyst, it is because the original cyst that caused the endometriosis would not have been picked up at the time, as it would have already ruptured, and so it would not have been able to be observed. So sometimes it can appear that the endometriosis comes first and then subsequently a ovarian cyst will develop, but this is purely because the original cyst would have already ruptured and so would have been completely missed. Close to half of all women with endometriosis will experience infertility, and sometimes this can be because of hormonal imbalances caused by the condition, but it is often due to the body putting a temporary stop on reproduction until the conflict is resolved and the body feels that it is safe to reproduce and ensure the survival of the mother and the child. So now we have to look at why not everyone with ovarian cysts will develop endometriosis and why some cysts will accumulate too much fluid, causing them to rupture. Excess water or fluid retention is a survival mechanism initiated by the body when it feels abandoned, isolated, out of place, or close to death. Dr. Harmer referred to this as a kidney collecting tubule conflict, as it involves the kidneys. It is an attempt by your body to help you survive through a threatening situation that will leave you stranded. This can be experienced as a physical or emotional abandonment, rejection, isolation, abuse, feeling out of place, unsafe, away from emotional support, or feeling like your life is in danger. This excess fluid will accumulate all over the body, but in particular it will be drawn to any areas in the body that are undergoing any kind of healing process or repair. And so it is drawn to the ovarian cyst because this is in the healing phase, causing too much fluid buildup within it and eventually causing it to rupture. It will also be drawn to the reproductive system in general once the endometriosis has been established, causing swelling, bloating, pain, and more inflammation. If you can resolve or downgrade the conflict that is causing the water retention, you will notice a significant reduction in symptoms, particularly pain. This may not always be the easiest task, as we are often not aware that this conflict is playing in the background or where it came from. But with some guidance and plenty of digging, it is definitely not impossible. You will know you are getting somewhere in healing this wound when all of a sudden your urine output significantly increases. You may also experience night sweats and excessive fatigue during the healing phase of this conflict, but this will eventually also stop. Once you are confident that you have resolved this conflict, you can then look at unearthing the conflict that is causing the ovarian cysts and make sure that you have fully resolved it so that you can ensure that there's no more reoccurring ovarian cysts. I would absolutely recommend that you work with someone who knows about this process, because sometimes it can be very confusing and daunting to understand what your body is doing while it heals. And as a side note, I am not implying that this condition is purely psychological. The physical changes and symptoms that occur are definitely real and can cause a lot of agony. It is also not the case that if you have this condition, it is just because you are choosing to allow it to happen through some kind of negative thinking. The process whereby this condition manifests is completely below your conscious awareness, and you really do not have a choice in the matter because it is an automatic response triggered by your autonomic nervous system, and it is only through your awareness of what is happening that you can change this. Now, although this video still leaves so much unanswered, because the current medical research is looking in the wrong direction, there's still so much left to be explored. It is my hope that this information gets out there so that women understand and become empowered and take their healing and relief from this condition into their own hands rather than wait for the medical research to play catch up. So I hope this video has been helpful, and let me know if you have any questions.